Okay, hello everyone, and thank you for joining in today. I already gave our members that are here live a little warning, but I'm going to go ahead and give a recorded warning as well. Viewer discretion is advised because we're getting into adolescence. We're talking about more adult content, and so if you have little ones who like to listen in on these lectures, most of the time it's completely appropriate. Today, it is not going to be as appropriate. So I'm going to ask that if you have little ones that they don't listen in unless you're prepared to talk about what they hear. So I'm going to go ahead and get started. We are now in adolescence. So I will tell you, I am so excited for this semester because with our old textbook, the way it was broken up, I never got to talk about adolescence. We always ran out of time. It was maybe a short like 1-day lecture of adolescence, and it wasn't in depth. It wasn't as much as I wanted to get into it. And this is the first semester that we get to go through all physical, cognitive, and social emotional development in adolescence. So I'm very excited about it. So let's go ahead and get started with physical development. So if you've ever had a teenager, or you have a teenager in your life, or if you can remember when you were a teenager, this is a stage of tremendous physical growth. These are the times when the extremities are growing a lot faster than the torso. So it's really funny how growth happens in adolescence. It's the arms, it's the extremities, the legs, the feet actually grow first. So if you see a child in like 5th, 6th, 7th grade, usually their feet are really big and they're tripping over everything and they look really clumsy, but it's because their extremities are growing faster than their torso. You also see teenagers look a little bit lanky, not really know what to do with their bodies. It's kind of an awkward stage of development in that middle school age. But by the time they're in mid-high school for boys, even late high school into adulthood, they start to proportion out a little bit more and get a little bit more coordination over those extremities. When we talk about height, girls tend to grow taller faster, and then boys catch up. So it's really interesting to see class photos in like 5th or 6th grade, and all the girls are like a whole head taller than all the boys. And then when you get to high school, a lot of times the boys will catch up. But sometimes boys don't start to grow until even after high school. So 17, 18, 19, into their 20s, boys can still continue to grow, where girls usually stop their growth at about 14 to 15 years old. So it's really interesting. Girls are usually the tallest in their class in 5th and 6th grade, and all of a sudden it switches like, oh, whoa, you were really short in middle school, and all of a sudden you're 6 foot tall. How did that happen? So it's really interesting to see. I love the summer breaks when you don't see children and then all of a sudden you see them again, like, whoa, what happened to you? You grew a whole foot. It's because of all of these hormones that are happening in an adolescent's body that are causing some really major growth spurts. Let's see. This is also when we're seeing differences in how children are growing when it comes to their sexes. So females are going to gain a lot more body fat because, again, they're preparing for menstruation and eventually having children. And so they're gaining more body fat in different areas than boys typically do. Whereas males are getting stronger and growing in muscle in different places in their bodies. Their shoulders are broadening. They just look a lot more athletic in their build. I'll never forget the day my baby brother, all of a sudden he came into the kitchen. I'm like, you don't look like a little boy anymore. Who are you? Like, it's just this overnight change. Like, no, that's not the little baby brother I know. And their voice starts to change, and you just hear all these different hormones coming through, and all of a sudden it sounds like you're talking to a grown man, and it's not. I'm like, you're 13, 14 years old. What is happening? So all these really significant changes are happening. So adolescence is a really turning point for children. Okay. Questions about this physical growth, height, and weight? Okay. Okay, our brain growth. I love talking about what's happening in the brain. Our frontal lobe is developing significantly in adolescence, but it's not fully developing, especially that prefrontal cortex, until age 25. So I love asking this question in class, how many students are under the age of 25? Because it's about 70% of my students. And then I tell them, don't worry, there's still hope. Your brain is still developing. That prefrontal cortex is not done yet. So you still have growth to do in your decision making and in your planning and in your your ability to regulate your behavior. So let's see, let's keep going. The brain is more interconnected and specialized. So this is both a good thing and could potentially also make it harder to learn different things. This is what makes it harder for us to learn a second language as we get older. With the specialization, remember we talked about myelination and how it helps messages and connections travel faster and more efficiently. Well, also with myelination, what that does is prevents plasticity and malleability in the brain. So that's why it's a lot harder for us to learn a new language when we're older, because all those connections for language are so steadfast and so strong that it's really hard for them to break away and form new connections. We're also going through this stage of synaptic pruning. Do you remember what synaptic pruning is? You thought we were done with it in early childhood. No, we actually go through it again, and even more so in adolescence. And it's that same, if you don't use it, you lose it. And it's not always bad because, again, it helps with efficiency of connections within the brain. Another thing that's happening in the brain is the growth, the thickening of the corpus callosum. And if we remember, the corpus callosum is that central piece in the brain that supports the messages and the communication from one hemisphere to the other. So with it getting thicker, what it's doing is allowing the hemispheres to communicate more efficiently and a lot faster with each other, which leads to greater coordination, which leads to greater processing of information. It's a good thing. We want that corpus callosum to thicken. Okay. And then lastly, the hippocampus is becoming more connected to your frontal lobe. And the hippocampus is what's responsible for a lot of the memory that we have. So for example, we're using memory of a negative consequence, and we're using it to make future decisions. So, I remember let's see, I wore those shoes to school, and I tripped and fell on the stairs. Like, I'm not going to wear those shoes to school anymore because I remember what happened before. So I'm using memory, and I'm using it to make future decisions. Questions about these things? No.
Yes, when it comes to learning language, is sign language, is it the same? Because it technically uses different parts. Do you process it the same as having trouble learning and verbal language?
Yeah, so what we're missing as adults is the emotional connection to the language. Even with sign language, when you learn it earlier and you're immersed in it for a longer period of time, when you're talking, you're signing with emotion. And so you have the facial expressions, you're clearly emotive when you're communicating. Whereas if you're learning later in life, what you're doing is focusing so much on the translation and the actual word that the emotion is taken away from it.
Okay. I signed up for that next year too.
Yay! That's a great class at JC. Okay. So all these changes happening in the brain, and what we know about adolescence is this is a time of a child's life when they are engaging in the most risk-taking behavior. And I'll tell you, when we think risk-taking, we think, oh no, bad teenagers, but it's not all bad. Sometimes risk-taking could be beneficial for transition into adulthood. But first, let's talk about some of the not so great elements of risk-taking behavior. So when we think risk-taking, that's poor decision making, weak emotional control, and then you combine those two, you're seeing that there's an imbalance between the limbic system, which is responsible for emotion, and your prefrontal cortex, which is responsible for making decisions. So if you have your limbic system that's really overactive in expressing emotions, everything is a big deal. You're really mad when something goes wrong. You're really excited when something goes right. And then your prefrontal cortex is saying, well, you're not that great at making decisions, but I'm going to make them based on emotion. That's sometimes a recipe for disaster. So that's what's happening in adolescence. The way teenagers weigh benefits and consequences of risky behavior is a lot different than the way an adult would weigh those consequences. In fact, they're going to say, I'm going to do this. The benefit that I get from it, the way I feel when I engage in this risky behavior, is worth any consequences, right? Like my daughter would say, YOLO. So you only live once. And she would be so embarrassed if I said that right now. But it really is that idea of you got to do it right now because it feels good right now in the moment. Those consequences, they won't happen to me. They only happen to some people, or the people that don't get, or that get caught. Okay. They're extra sensitive to the dopamine reward system. So every time something good or positive happens, that dopamine is like the best high they've ever felt. I'll never forget this study about likes on Facebook. Has anyone seen that study with teenagers and likes on Facebook? They actually get dopamine every time they see a like on Facebook, which becomes addicting. They become addicted to the likes that they're getting. So they see a like and it's like this feeling of love and happiness and joy. And then they're craving that same feeling. So they're always addicted, like, oh, did I get a like? Did I get a like? Did I get a like? And then they engage in media behavior that's going to get them the most likes from complete strangers. It doesn't matter who they're getting the likes from. It's just the actual function of getting a like that gives them that feeling. Let's see. They also receive dopamine. Sorry. This is supposed to be oxytocin, not dopamine. So oxytocin is the bonding and social connection hormone. And so when you combine dopamine, which is that feels good, that feels great, and then oxytocin, which is I want that to feel good and great with this group of people because it's important for me to have that connection with others, we see that teenagers have a greater chance of engaging in risk-taking behavior when they're with their peers. Most of the time, if they're by themselves, they won't make that same risky decision compared to when they are with other people. That social pressure of, I really want this group of people to like me, and so I'm going to do something that I wouldn't necessarily do if I was by myself, because that reward, that dopamine I'm going to get, is worth it. So it's such a chemical interaction. We think, oh, it's just peer pressure, but there's things happening in their brain that's causing teenagers to engage in this type of behavior. I really like this video. I encourage you to watch it when you get a chance. It's about risk-taking and peer pressure and what's happening in the brain. And it actually goes over Steinberg's theory that you are reading about in your text. So it was perfect. Questions about this? So forgive my error. That's supposed to be dopamine and oxytocin. Okay. All right, let's keep going. So what happens with abnormal development? So 50% of mental illness occurs by age 14, and then 75% of mental illness is already evident by age 24. And what we're going to talk about later on in the chapter is how a lot of times children, adolescents, and even young adults don't get the support they need because of the stigma that comes along with mental illness. Nobody's talking about it because they think they're at fault. They think something's wrong. And really, when you don't get support, it could lead to some really severe consequences, especially when mental illness starts so young. Okay. children who and adolescents who experience mental illness are especially vulnerable to drugs because they're looking for an out. They're looking for something to make them feel better, looking for something to stop the pain, to stop the anxiety, to stop the stress, to stop the depression. And drugs seem to be an easy fix at the moment. And we'll talk soon in this chapter about why that is not going to be beneficial for them. What we know about marijuana is it's illegal, right? And so that's always the thing I get when I talk to youth about drug use is, well, it's legal and they wouldn't legalize something that's bad for us. When marijuana is used medicinally and used as a is regulated by a professional, especially when it's the CBD and not the actual hallucinogenic THC, there's different results. So when an adolescent is using marijuana recreationally, we see more harmful consequences than if they were to be using it for medical reasons under the guidance of a professional. So they can't be self-diagnosing and being like, yeah, it's medicinal, but I use it 5 times a day, 5 days a week. Like that's not medicinal. So knowing that is important. Novelty seeking and risk taking can generate positive outcomes as well. So like I said, it's not just negative risk taking that we're talking about in adolescence, but we want children to want to take chances. We want children to want to branch out, to meet new people, to go out for that job interview, to introduce themselves to that potential employer, to go and talk to college recruiters, to live in the dorm one day out of college. That's all scary and risky. So if you have a child who engages in those positive risk-taking behaviors, it could lead to positive results, not just negative consequences. Questions about that? Nope. Okay. All right. Oh, puberty. We all know exactly what I mean. You might cringe when you think of puberty because it brings back really bad memories. Maybe you had a really positive experience with puberty, which I hope you did. But what we know is that girls typically go through puberty sooner than boys do. Right now, we know that girls are going through puberty a lot younger than any time in history. It can start as early as 9. I've known young girls to start their menstrual cycle as young as 8. And so I want you to think about that just for a second. Knowing what we know about what's happening in an 8-year-old's brain cognitively, and then what you go through physically and emotionally when you are a woman and go through I'm so sorry. My daughter is standing at my back window with a sign trying to talk to me. So I'm just going to tell her yes for a second. My neighbors are here to mow the lawn. I don't endorse child labor, but I pay them well and they're here to mow my lawn. Yes, they can do it. Okay, I will have to edit that out of this recording. So apologize. Where was I? So girls as young as 8 years old, so think about what that imbalance can do to a young girl who's 8 years old and starts her menstrual cycle. That could be pretty damaging emotionally and really difficult to understand and take care of. We know that 8-year-olds can't really follow a routine that well. So knowing that you have to actually take care of yourself and the cleanliness that comes along with it, that's really difficult. So even a child as young as 9 years old who starts their menstrual cycle, cognitively, it could be a lot more difficult than say a 14-year-old who starts their menstrual cycle. We also know that because the body needs a certain amount of fat for menstruation, a child can start their menstrual cycle, let's say at 11 years old, but if they all of a sudden become really active and lose a lot of that body fat, sometimes you'll see a delay in their period, so they won't have their menstrual cycle for months, like maybe 6 to 7 months because they don't have as much body fat. Okay. In boys, puberty tends to start later, but also go later. So it can start as early as 10. And sometimes boys don't start puberty until 17 years old. And so we'll look at what happens when children don't start puberty until later and what happens when they start too early. So there's two phases in puberty. The first phase is the pituitary changes. This is what triggers the sex characteristics. So in boys, this is a surge of testosterone. In girls, it's a surge of estrogen. And it's causing the sexual characteristics to change and develop. This is also what increases height. So height increases from 20 to 25%. Girls can grow 2 to 8 inches. So typically they're growing before they start their menstrual cycle. Usually once the menstrual cycle starts, the growing slows down. Girls can grow up to 4 or 5 inches while they're waiting for their menstrual cycle to start. And then once it starts, they usually only grow about 2 to 3 inches after that. Whereas boys can grow 4 to 12 inches as they're going through puberty. That's huge growth if you think about that. Like, that's a boy who just went from 5 foot to 6 foot in 4 years. That's a lot of growth for young boys. The second phase is our visible physical changes. This is typically your facial hair, your pubic hair, acne. So this is so many children. I think it's 80%, 85% of children develop acne, which could be really difficult for teenagers who are going through egocentrism all over again. So remember, we talked about 3-year-olds. You're going to hear a lot of the same things being talked about when we talk about teenagers. That's why this whole new thing about 3-year-olds and teenagers often go through similar things emotionally. So if you think about egocentrism in teenagers and they have one pimple, their egocentrism is telling them, everyone in the world is looking at my one pimple. Nobody can look at anything else but my one pimple. And so it's really difficult to have acne in adolescence. So menarche is menstruation. It just looks different. It's just a fancy way of saying menstruation or your period, you might know it. And we talked about how it is linked to the amount of body fat. Okay, questions about these physical changes?
Yes. So if a teenage girl starts her period early and then becomes really physically active and stops her period, does her growth pause as well? And then when she starts her period again, then she gets those last couple inches of height, or does that stop?
That's a really good question. I think it also depends on genetics.
Yeah.
So if genetically the child was already going to be taller but started menses early because of increased body fat, then they probably would have a better chance of growing after that menses was stalled after becoming active.
Okay.
But like I said, if genetically that child was always going to be on the shorter side, they might not see as much growth.
Okay.
Good question. Okay. All right, let's look at male anatomy. As I was making this PowerPoint, my daughter's like, what are you teaching tomorrow? So like I said, if you have young children, this is the part where they might want to step out of the room. So male anatomy consists of both internal and external genitalia. The primary reason for genitalia scientifically and biologically is for procreation and sexual intercourse for procreation. What's interesting is the difference between the male sperm cycle and the female ovum cycle. So males constantly and consistently reproduce sperm on a daily basis. They're reproducing millions of sperm. Whereas, as we're going to see for women are born with a certain amount of immature ova. That's 2 million immature ova. And as we get older, they're released during menses. So that's why women who are over 35 typically have a more difficult time getting pregnant because of the reduction in ova or eggs. Okay. The male sex organs are the penis and the testicles. The testicles are the organ that house sperm. and semen, which are what is being used for procreation. Okay. In the female anatomy, it's really important to teach young men and women about their anatomy because as they get older, it's really so frustrating to know young girls who don't know that when you put a tampon in, you can still go pee. Like, it really is frustrating that women and men don't know their own bodies. It's so important biologically and anatomically just to know what you have and what you're responsible for. If you don't know what you're responsible for, how are you going to then take care of it? So the external genitalia, also known as the vulva, includes things like the labia majora, the labia minora. This is typically the only thing young girls know that they have because they can't see what's inside. The only thing they can see is when they use the bathroom, what's there when they use the bathroom. The clitoris, the vaginal opening, and the urethral opening. When we talk about internal genitalia, this is typically only talked about when we're talking about menstruation, and then when we're talking about ovulation, and when we're talking about childbirth, because this is the vagina, the uterus, the fallopian tubes, which house the ovum. And remember, that's where fertilization takes place, is the fallopian tubes, and your ovaries. Okay. We talked about how females are born with all their ovums. So again, different from the male anatomy, which reproduce sperm every single day. Once you lose eggs, you don't reproduce eggs as women. The eggs you are born with are the only eggs you'll have your entire life. Okay. And then you lose them slowly with every menses cycle. Not only are you losing your ovum or your eggs, you're also, when you experience menses as a woman, you're shedding the uterine tissue and the lining of your uterus along with those eggs during menses. Okay. Questions about female anatomy? No? Okay. I know they have sex ed in high school, but I don't know a lot of children who pay attention. And I know even more whose families opt out of it, which I strongly discourage, especially when it comes to anatomy, because again, it's so important to know about the body. And as a parent, if you want to say in what your child knows, learn what they're learning so you can have those conversations with them as well. It's the open lines of communications that are key in this topic. Okay. So what are the effects of puberty on development? Here's when we talk about what happens when children develop too early or too late. When we have young girls developing earlier than boys, we have boys that don't know how to inhibit their behavior. And then we have girls that are developing things like breast and having to wear bras. And you combine those two, and you often have girls who feel ashamed of their bodies, who feel like they have to cover up, who wear big sweatshirts when it's 100 degrees outside because they're embarrassed of their changing bodies. You also have young girls who are victims of sexual harassment, and even if a child is in 5th grade, it's not teasing if they snap another 5th grader's bra, or if they are, talking about that young girl's body. That is still sexual harassment, and it's important that we treat it as such so that we can teach children, both boys and girls, really young, that it's not okay. In any situation, it's not funny, it's not appropriate, and it's not okay. But girls who develop earlier are at greater risk for that early sexual harassment. Let's see. So with boys, again, peers are the most important people in a young child's life, especially in adolescence. And so when you have young boys and there's one in a group of 5 who has not yet gone through puberty, this is the the boy whose voice is still cracking, who's a whole, head shorter than other boys that he's hanging out with, who doesn't have the same athletic build. A lot of times they're more prone to teasing, a lot more at risk for bullying. So thinking about a young boy who doesn't develop as early as their peers, they might be left out and more prone to teasing. The interesting thing is, just like we talked about how young girls who develop earlier are at risk for sexual harassment, young boys who develop earlier actually tend to be more popular. So it's a more positive thing for boys, not as positive for young girls, which is just so interesting to me. Let's see, young girls also who develop too early or earlier than other girls are at greater risk for anxiety, depression, substance abuse, and eating disorders in order to kind of disguise that early development. Questions about this? Nope. Okay. Let's keep going. All right, the brain and sex. So sex is not just a physical act. It has a lot to do with what's going on in the brain, especially in adolescence. So the cerebral cortex, which is responsible for thinking and reasoning, is also where sexual thoughts and fantasies originate. And so in adolescence, they're now having these thoughts and images happen based on media, based on, we have the highest rate of porn exposure than ever in history. So young children are watching really inappropriate and unrealistic images of sexual interactions. And there was a research study shown that when especially young boys are watching pornography at an early age, their expectations of what sex is going to be like is completely unrealistic, and they're more likely to engage in sexual behaviors that are undesired and might be dangerous when they get older, because their understanding of what sex is supposed to be is completely inappropriate. Okay. The limbic system. So remember, that's our emotional storehouse. That's the amygdala, the hippocampus, the cingulate gyrus. All of these parts of the brain are where these feelings are generating. So you get that attachment, you get that love, you get that need to have sex combined with the sexual thoughts and fantasies, and you get children, and I say children because teenagers are still children, but you get teenagers who have a sexual drive and a sexual desire that is not just something that's a stage, it's an actual biological drive. And so instead of ignoring it and saying, no, that's still my baby, knowing that this is something that's happening in an adolescent's body is important. Okay. Here are those hormones again. So the oxytocin that's released during intercourse in females, again, that's that bonding hormone. And so you have girls who are seeking a connection, a physical connection with the opposite sex or with the same sex. And that release of oxytocin is very bonding. So if you've ever heard stories about how a young girl with her first partner has this very strong connection, it's that release of oxytocin. It's an actual chemical connection. Testosterone is a major contributing factor in sexual motivation for males. So that really big surge of testosterone in adolescence, combined with all of the other emotional hormones in youth, also drives them to want to engage in sexual behavior as well. Okay. Questions about the brain, what's happening in the brain and adolescence, motives and drive for sex? Nope. Okay. All right, let's keep going. So we have youth that want to have sex. Now, what do we do? What do we do as far as pregnancy? What do we do about birth control? And then we'll talk about what do we do as far as sexually transmitted infections. Even though teen pregnancy rates have dropped and declined significantly, we still have in the United States one of the highest teen pregnancy rates out of all the industrialized countries. Um, why? Why do we think that? There's a few reasons, but let's go over some of the statistics first. So in 2014, 24.2 out of 1,000 women ages 15 to 19 experienced pregnancy. This is actually a 9% drop from years before. So it's an improvement, but we're still seeing a lot of young girls getting pregnant. We know that birth rates have fallen from 11% to 7% between women 18 and 19 years old. So a lot of the researchers are looking at why. Why are we seeing a decline in these rates? And it's really funny that one area that takes a lot of the credit for this decline is actually the show Ch13 and Pregnant and Teen Mom. They've attributed some of these lower pregnancy rates and lower birth rates to young girls actually seeing a more realistic struggle of a teen parent. You can agree or disagree with that, but it might have helped, but the key word here is realistic. Are we really seeing a realistic portrayal of what happens with teen mothers as their children grow? Not really. Most teen moms don't live in giant houses and drive expensive cars and go on reality shows. And so some might say that it's actually giving young girls motivation to become pregnant for the infamy. What we do know that teenagers these days aren't having as much sex as they were 10 years ago, 15 years ago. And if they are having sex, they're using more birth control. So they're more aware of birth control methods out there. People are talking about birth control more frequently and more openly. Something your book doesn't talk about, but a research study that I've read and shared with students is that we know that abstinence only education actually has a higher rate of causes a higher rate of teen pregnancy than birth control education. Because if the only thing you know is don't have sex, but you don't know what happens when my body and my hormones take over and I do have sex, what do I do then? That's a recipe for pregnancy because there's a lack of knowledge. There's an ignorance there. Risk factors for teen pregnancy include disorganized and dangerous neighborhoods, lower socioeconomic status, living with a single parent, having a sibling who's already sexually active might hold an example for the younger sibling. If that young child goes through early puberty, and then victims of sexual abuse as well. So what helps to not have a child get pregnant during their teenage years? Having that open relationship, the parent-child closeness, having the child come to you as the parent when they're ready to engage sexually, when they have questions about birth control. That's also important. Parental supervision. So I'm not saying sitting between a boy and a girl, but being present, right? Having couples go out in groups instead of alone, just making sure that those children and adolescents don't have the opportunity for sexual interaction can prevent teen pregnancy. Also, parents' values against unprotected intercourse. So that's that conversation about if you're going, I prefer you don't have sex, but if you're going to have sex, here's what you can do. Here's how you can protect yourself, not only from pregnancy, but here's how you can protect yourself from sexual transmitted diseases and sexually transmitted infections. Those are important conversations. Are they comfortable conversations? Absolutely not. I guarantee that your teenager is going to cringe, that you as a parent are going to be uncomfortable, but they're necessary conversations. What are the consequences to teen pregnancy? 40% of teen parents graduate from high school, which means 60% do not. And if you think about that, a high school diploma means a better job, means making decent money to at least pay for diapers and formula if you're on formula, pay for clothing, pay for daycare. Um, but that's 60% of teen mothers who do not graduate from high school. That's huge. My favorite statistic, because as many of you know, and I share with many of you, I was a teen parent, is that only 3% of teen parents graduate from college. And that statistic always stuck in my head, that 3% graduate from college. That's not a lot, and we need to do better for our community. If young women are becoming pregnant and not getting the support in order to achieve their educational goals, then we need to step in as a community, which is why I love community college, because we do have programs that can support young women and young men who are teen parents who want to go further in their education. Okay. Let's see, children of teen parents. So these are children whose parents were teenagers when they were born. They are 50% more likely to repeat a grade, more likely to perform more poorly on standardized testing, and even drop out of high school themselves. So a lot of this is cyclical. So if a lot of teen parents are children of teen parents who are children of teen parents. So teen parenting often follows this cycle. And it's interesting that it's not only the mother. So I'll share, my father was a teen parent, his mother was a teen parent, and I am a teen parent. So I will be darned if my daughter continues that cycle. I know all of these statistics. I will never forget sitting in this 103 class and hearing the statistics of children from teen mothers and asking, what do I need to do to lower these statistics? What do I have to do? And I remember the answer was, the higher the educational attainment, the lower the risk of repeating the cycle. So I went for my master's degree. So it really, thank you. So it really is something that's always struck a chord with me, is I don't want to be one of those statistics, but I've also had a lot of family support. I've had people say it's going to be hard, but you can do it. And a lot of people say, this is your choice and your child, and so you need to be responsible. And so I was held accountable for my decisions and learned how to be an independent mom and still go to school and grow up really quickly. And that's what's happening with these young girls, is they're having to grow up so quickly. And a lot of times that idea of missing out on a certain part of their adolescence is what leads to that poor maternal connection sometimes in teen parenting. Questions about this?
I have a comment about one of my friends, in high school, she had 2 children her senior year, and kudos to her, she graduated with honors.
That's
She
amazing.
had so much support from her professors, from counselors, and her family, and it made me really happy to see her, that as she was walking the stage, she was crying just because a lot of people were telling her, you can't do it, you're going to drop out and everything. And she proved them wrong. She showed them that even though as a teen parent, she was able to do everything that everyone was telling her that she wouldn't be able to do. But she had a lot of support, and it's amazing to see how people, just by reaching out, like, they will help you. You just have to do is ask.
Right. No, thank you for sharing that, Abby. Support is huge for this population of adolescents. If remember, this is still a teenage brain with a baby. And so the support in, okay, let's figure this out is important, because now you have a teenage brain that's also trying to be an adult with adult responsibilities. That's not an easy balance. So providing support is a slippery balance. So thank you for sharing though, Abby. Okay, so now let's talk about sexually transmitted infections, also called sexually transmitted diseases, also called venereal diseases. These are anything that can be contracted through sexual behavior. Every time I see this topic, I'll never forget. I have a sister who's 8 years older than me. So by the time I was in high school, she was in college at UC Santa Barbara, and she was taking a human sexuality class. And my mom's solution to preventing me from being sexually active was to have my sister show me the images in her sex ed class about what it looks like to have a sexually transmitted infection. So these were pictures of STIs and STDs, completely traumatizing at 15 years old, I will tell you that. But that was my mom's solution to this. I don't recommend it as an effective prevention of STI, but there are ways to prevent STIs. The most common ones we see right now, especially in young adolescents, this statistic just astonishes me. 15 to 24-year-olds account for half of all new STD infections. Half in adolescence. What are we doing wrong as educators and as families? What's happening here? Typically, we see cases of chlamydia and cases of herpes, cases of syphilis and gonorrhea. HPV has risen significantly to, oh man, I just read a statistic, but it's something like 1 in 5 or 1 in 4 women will contract HPV in their lifetime. You might be asymptomatic, but that HPV could lead to longer term consequences like cervical cancer in adulthood. There's now a vaccine for HPV that is given at age 12 or age 11, so it's given twice. It is not required, but it is offered. So once a young girl or young boy gets to that age, the pediatrician will recommend that they get the HPV vaccine, because we know that in adolescence, they're being sexually active, and that's the primary way to contract HPV is through sexual interaction. And when I say sexual behavior or sexual interaction, it's also important to talk to adolescents about the different ways to contract an STI, because vaginal intercourse isn't the only way to contract an STI or an STD. So talking about oral intercourse and anal intercourse is important. Extremely uncomfortable, I get it. But they're going to find out from somebody. If it's not from a parent, it's going to be from a peer or from media. And I guarantee you'd rather have it coming from you as the adult, the responsible adult to the child's life, than from media or peers. The most effective way of prevention is abstinence, but safe sex can also prevent STIs as well. Okay. Questions about this? No. Okay. So what about birth control and other preventions of STI? I like this chart a lot because it shows you birth control and STI prevention according to the how effective they are and if they are reversible or completely permanent. So on this side, you'll see all reversible preventative measures, and then you have permanent solutions, which sterilization. Very, very rarely will anybody in adolescence be sterilized. Completely unethical, but if there's a medical reason, typically that's the only reason for sterilization. And Tracy, your dog's loving you right now.
I know they're going wild.
So it's important to look at this chart if you're talking to a youth about what their options are, looking at the side effects of some of these contraceptive measures, and then also the effectiveness. So yes, you might have less side effects from a vaginal ring, but the effectiveness is less than something like an IUD. So looking at the differences between the different measures. I love that it shows how many pregnancies for every 100 women, so that you can see that not any of these are 100% effective in preventing pregnancy. And then also, if a male is wearing a condom, but then they're engaging in kissing and that person has herpes, you can still get an STI. So talking about what these look like and how you can contract them is important in this age. Okay. All right. Questions about these contraceptive methods? Nope. Okay. Really quickly though, I just want to point out this fertility awareness based method. This is more colloquially known as the pull out method, which I strongly advise against. It is not something that is effective. It is not something that is guaranteed in any way. So really, I talk to adolescents about all of these terms that they might hear and what the risks are to some of these methods. Okay. All right. Let's move on to talking about sleep, diet, and exercise. We know that youth are not getting enough sleep. What's happening in adolescence is something called their circadian rhythm. We all have a circadian rhythm, which tells our body when to relax, when to sleep, when to be awake. And what's happening with the circadian rhythm in adolescence is it's telling them, their bodies, to stay awake longer. So you have adolescents who have a really hard time getting to bed early. They're wanting to stay up till midnight, 1 o'clock in the morning. And then they have a really hard time waking up for schools that start at 7:30 in the morning, 8 in the morning. And a lack of sleep just leads to consequences all day long. So a lot of schools have formed this movement to push start times of schools to a lot later, like starting at 10 a.m. so that children and youth and adolescents have a greater ability of getting adequate sleep, because 7 to 10 high schoolers don't get enough sleep and 6 out of 10 middle schoolers don't get enough sleep. So that's a majority of our youth who are not getting enough sleep. And what we know is that it impairs behavior, it impairs attention, and if you can't attend, then of course your academic achievement is going to suffer as well. It also leads to more incidences of tardiness and absenteeism because they're tired. So they wake up late, they're rushing to get ready, and then they're late to school. It just all kind of trickles down. So thinking about, should a school go to 10 o'clock? What are some benefits and some consequences of that? Okay. Questions? No. All right, let's keep going. Has anyone ever heard of Maslow? So Abraham Maslow is a theorist who talks about the hierarchy of needs, and he has this pyramid to describe his hierarchy of needs. I refer to Maslow all the time. This doesn't only reference children's needs, but it's all human beings' needs. And what he says is that all human beings need to achieve these lower levels first before they can achieve any of the higher levels. And the lowest level are air, water, food, shelter, sleep, clothing, and reproduction. So these are physiological needs. So if a teenager and any child, or even as an adult, if we don't have adequate food, if we're not getting adequate sleep, if we're worried about the fact that As youth, we have holes in our shoes and our feet are freezing in a 20-degree winter. We can't focus on anything else. Nothing else is going to be important. We can't learn. We can't engage in social interaction. We can't do anything outside of working to meet those physiological needs. Another study showed that when food was scarce, teenagers couldn't even build relationships. They had no desire for, it decreased their sexual desire, it decreased their desire to socialize, it decreased their desire for anything else but getting food. That's how important those physiological needs are. Questions about this hierarchy? Nope. It's why in class, every test day, I said, here's snacks, eat your snacks, because I know how important it is to your brain to be fed, to have something in your stomach, to have something nourishing your brain. Okay. Speaking of nourishment, let's talk about nutrition. And I got my daughter's permission to use her picture in here. That's her eating a fried Oreo. So nutrition doesn't always look perfectly, but we do know that in adolescence, girls are needing more calories and boys are needing more calories than in middle childhood. But their caloric intake is dependent on several factors. First of all, their gender, their growth, so how quickly they're growing, and their activity level. So if you're a child who lives a sedentary lifestyle, you're going to need less calories that you're taking in. But if you are someone like my daughter who doesn't sit still for very long and loves to run and loves to do yoga and loves to work out, she can afford a fried Oreo every now and then. This was probably one of the happiest days of her life. She had never had one before. We were in Santa Cruz and she begged, please, can I have one of these? They looked completely disgusting. She said they were the best things she'd ever had. As you can see from her face, she was just so happy. I asked her if I could use it and she said, let me see the picture first. She approved it and then I was able to add it to our slide. But it just goes to show you that nutrition doesn't mean deprivation. We're not saying you can never have anything sweet, no junk food ever. It just means moderation. So smaller portions, balancing that with a greater activity level. Children and youth who are in sports year round or play a seasonal sport, they're going to need more calories during that time than at any other time because they're burning so many calories during that activity. Okay. Exercise isn't only important for physical health, but it's also important for mental health. It lowers stress that so many adolescents experience, and it improves feelings of well-being. It also it increases that oxytocin, it increases dopamine, so that you're feeling good about life. Okay. Questions about this? No. Okay.
No, but a quick comment.
Yeah.
So I'm kind of a health nut and only have been over the past like 6 years because of a lot of health conditions that I had. So I really educated myself since then. And so when people find out that I'm super health conscious, they're always like, oh, you don't eat anything sweet. And I'm like, no. Mama needs her cookies. Like I bake stuff all the time. There are candies out there that I buy. I said, but I pay attention to ingredients. That's the key. Like, are you eating stuff with high fructose corn syrup and, food coloring and all that? Or is it pure sugar and cocoa chocolate? Like it's, so people kind of have that misconception that it's like no junk food. And I'm like, no.
Yeah.
It's ingredients. It's what, if you're going to have the calories, make them count.
Right. And it's all about balance and teaching children that.
Yes.
And straying away from the good and bad food.
Yeah.
There's different ways of saying like these are always foods, these are sometimes foods. It takes the shame out of eating and out of
Yeah.
food. When we refer to foods as good and bad, there's shame associated with eating the bad food, like, oh, I ate something bad. And when we talk about eating disorders in a second, a lot of times it's that association with good and bad food.
Yeah. Agreed.
Thanks for sharing that, Catherine.
Mhm.
Okay. Look at these transitions. I love when they happen so smoothly. So when we talk about eating disorders, it's important to note that both men and women can experience eating disorders. However, women are 2.5 times more at risk for experiencing an eating disorder than men are. Some of the risk factors include genetics. We know that eating disorders can be hereditary. Also biology, behaviors. So how does the family talk about body image? How much of a value is placed on a certain image of how a woman or how a man should look? Where's the importance placed? So psychological and social factors. What are young girls and young boys looking at and idolizing? What images are they aspiring to, and are they unhealthy images? So I feel lucky that my daughter is growing up in an age where body positivity is a big thing right now, and loving your body the way it is, being healthy, staying active, knowing that there's so many different ways to look healthy is so important for young men and young women to know that there's not just one type of body. There's not just one type of beautiful or handsome. There's so many different ways for your body to look and still be healthy. So I feel good about where this movement is going. I don't think it's perfect yet, but I definitely think that we're going in a positive direction. So some of the eating disorders that are discussed in your book are anorexia nervosa, bulimia nervosa, and binge eating disorders. There's often times where young girls and young boys are diagnosed with more than one of these at the same time. They sometimes go hand in hand. And these often aren't found until it's too late. So they aren't diagnosed or aren't noticed until there's really damaging physical consequences and emotional consequences to these. Some of the things to look for are children who are just over putting so much importance on the way that their body looks. Frequently looking in the mirror, frequently weighing themselves is another thing to look out for. Also, young girls and young boys who are overly moderating their food intake. So they're measuring things in a way that's not healthy. There's a healthy way to do things and there's an unhealthy way to do things. So knowing the difference. Some of the physical consequences, slow heart rate, reduction in bone density. What's really interesting is that eating disorders often have the same health consequences as obesity, hypertension, diabetes. All of these things that we worry about with obesity often also show up when we look at anorexia nervosa and binge eating disorders. So it's really interesting to see how the body breaks down when there's an unhealthy balance of nutrition. For treatment, a lot of the treatment for eating disorders is going to be psychological, nutritional counseling, individual, group, and family therapy. So it's important to include the family because a lot of times eating disorders are triggered by a family dynamic. And so just supporting the individual isn't going to be a fix-all. Really supporting the entire family is important. Questions about eating disorders? Okay. Let's move on to drug and substance abuse. So we talked about what's happening in the brain. We talked about risky behavior. We talked about how youth are craving that oxytocin that bonds them to their peers. And so you get this increased risk of experimentation with things like drugs and alcohol. For youth that are exposed to drugs and alcohol, it's really hard to say no. It's hard to be the one person not getting high. It's hard to be the one person not drinking. But teaching children to have the self-confidence and know the consequences of even experimentation to addiction. Addiction is, especially if the child is already disposed to addiction, because remember, there's an addictive gene that can be passed down and either turned on and off through epigenesis, we talked about. And so if you are a youth that has a family history of addiction, experimentation it can lead you down a really bad road. Even trying something once can trigger that gene. I will share with you all that addiction runs in my family, so we are very open about that. So my daughter knows that it is not a good idea to even try something once, because addiction is so prominent in our family, on both sides of her family. And so her knowing what addiction can lead to, she has no interest at all. I don't want to say it scared her into not wanting to do anything, but it really just made her aware of the consequences. And I tell her, where as somebody who doesn't have this addictive gene in their family can try something and never do it again, you're at greater risk of trying something and being addicted for the rest of your life. And so do you want to take that risk? So that's an open conversation and dialogue that we had as soon as she got into middle school. So by 5th grade, we had already had this conversation. Questions about that?
I was going to ask you when you had that conversation, because I think I'm in the same situation as you, and that's a conversation I'm going to need to have eventually. My son's 8, so.
Yeah. I waited until 5th grade. 5th grade is usually when they have like the drug awareness talk. And I don't know if any of you were around during the DARE ages, right? Yeah. So I had my DARE t-shirt up until recently, but so I waited until then, and I felt like maturity-wise, cognitively, she was ready to hear that and ready to, because unfortunately, children are being exposed to drugs and alcohol at a younger and younger ages. And so I wanted her to know what they look like, how people would offer, and how to stand up for herself and say no if she were to be ever offered something. So the types of drugs that your textbook discusses are psychoactive drugs. And when we talk about drugs, it's really easy to go automatically to illegal substances, but coffee's a drug. It's a stimulant. And so it changes our state of consciousness. And I will be the first to admit, I have a cup of coffee every single morning. And when I don't, stand more than 6 feet away from me because I'm grumpy. And it really affects my mood. It affects my interaction. It affects me. And so teaching children that it's not only illegal drugs, but even caffeine can be something that you can become addicted to. Other stimulants include nicotine, cocaine, and amphetamines. We live in an area that's very high, and that's a bad term to use, high risk of methamphetamines. So really at risk for youth being exposed to amphetamines. Which is why, sadly, I see a lot of children who are pre-exposed in utero to amphetamines because their parents were addicted to amphetamines. Depressants are things like alcohol, barbiturates, what are commonly called benzos, so benzodiazepine, and toxic inhalants. All of a sudden it became really popular to sniff things like spray paint and glue, and these things are so addictive and deadly that one experimentation, and you're addicted for life. Opioids include things like opium, morphine, and heroin, which are also highly addictive. And then hallucinogenics, which includes marijuana. And again, we go back to, I know it's legal and I know that there are medical properties, absolutely. But when we are looking at recreational usage, that's when we see those side effects of lower educational attainment, the inability to focus. Remember, it changes your state of consciousness. So should you drive under the influence of marijuana? No. Should you make any important life decisions when you're under the influence? No. But youth don't think about those things because remember, the rewards outweigh the risks and consequences in adolescence. So thinking about those. Other hallucinogens include LSD, PCP, and peyote. There are different tribal nations that use peyote as like a cleansing ritual or to connect them to spirits, but they don't use it as a drug. It's used more as a traditional practice. So that would be a difference between recreational usage and a more tribal and link to heritage in their usage. Any questions about addiction and substance? No.
What do you think is a better way for educating children? Because it seems like some of the campaigns they've come out with don't really change the numbers that much as to who's even tried it one time. So as a kid, if they don't feel comfortable coming to you say, oh, I tried marijuana, because they know you're so against it. Mm-hmm. What is the best approach to that as parents or just as a school system or something?
Right. The best approach is the peer-to-peer or youth intervention. So if youth has a better chance of listening to other youth their own age talk about this content than if an adult were to come to the school and say, hey, when I was your age, I did this and it was bad. They don't care. They can't connect on the same level. But if I see somebody who's my age that looks like me, who maybe I would hang out with and be friends with, tell me that, they had a bad experience with drugs or they've been able to stay away because they're active in sports, that's going to be more effective than any adults trying to intervene. So the peer-to-peer intervention has been proven to be the most effective. But as a parent, it's really just open lines of communication, being open and honest with your children if you tried anything. I'll never forget the time my mother told me about her, and my mom is very traditional, very old school Mexican American. And so when she told me about some of her youthful indiscretions, I was so surprised, but it was really interesting to hear her say, this is how it made me feel. I didn't like this feeling. It was a horrible feeling. And then I remembered that our family has this history of addiction, and I knew to stop. I've always been I've always been scared to try anything my entire life because of that history. And so I'm hoping my daughter has that same, not fear, but respect for genetics and respect for heredity, and doesn't try either, but really just that open communication of this is what's out there, this is what can happen. You have to make decisions. Is that where you want your life to head down? Is that person's supposed friendship more important to you than your future? Right.
I just want to add, my dad used to be in a band, so he has all of these stories about different drugs and stuff that he's taken, but it's made me not want to try anything like that because of all these horrible stories he has. So I love that he's always been so open about everything that he's tried and everything.
Yeah.
So.
it helps. I just personally, I think it helps to kind of hear parents be real with you and not like, oh, I've never tried this. You should never try it either. It really is just an open, honest communication. We can't expect our children to be honest with us if we're not honest with them. Okay, let's keep going. I think I only have a couple more. Okay. So because so many changes are happening in adolescence between their brains and hormones and social interactions and exposure to drugs, and there's just so much happening in adolescence. It's a tough age. So many, especially teachers going into teaching, say, oh, any age but high school. Give me any age but teenagers, because they're so tough. But if we look at everything they're going through physically, cognitively, and socially, it helps us understand a little bit more why they might be a little bit more difficult to interact with and teach. It's not because they want to be difficult, it's because they're struggling balancing all these changes that are happening in their lives. And sometimes the struggle leads to some psychological disorders. We talked a little bit about this in middle childhood, but we'll just go back over some of these psychological disorders that can occur and start, as young as 12, 13 years old. So there's anxiety, there's dissociative disorder, mood disorders, schizophrenia. This is typically the time when schizophrenia starts to present, usually late adolescence after 16 years old. And then if you combine drugs and with adolescence and you already have a predisposition, this is typically when we see schizophrenia. Personality disorder, somatization, factitious disorder. This is typically with health. So with somatization, it's, everything hurts and I don't know why. And there's no connection, there's no diagnosis, it's just something hurts. Whereas factitious disorder, it's nothing really hurts, but I'm going to say something hurts because I really like the attention that I get when I have to go to the doctor and everybody's catering to me and everyone's taking care of me. One of the factitious disorders can be Munchausen syndrome, if you've ever heard of that. It's lying about being sick because of the attention that you get. There's sexual disorders, there's paraphilia, which is an inappropriate response to, or it's a sexual response to really inappropriate sexual interactions. And then there's depression, which is just all encompassing of so many different things. A lot of these psychological disorders can be comorbid, which means a child or youth can be experiencing more than one of these at the same time. Okay. All right, so mental health and wellness. Because we know youth are going through so many things during this time, it's important to know how to support them, what to look for, how to know when to intervene, not only as adults, but teaching youth how to intervene with their peers. So looking at warning signs for self-harm and injuries. Cutting has really become popular, and then hiding the cutting with bracelets or with long sleeves in hot weather. So knowing what to look for, if there's excessive bandages in your garbage can, if somebody is wearing a long t-shirt and it's 110 degrees outside, looking for those signs so that we can step in if we need to. Suicide has increased dramatically. More and more people are being affected by suicide, either somebody they know, someone they loved, or they themselves have experienced suicidal thoughts or tendencies. I'll share with you, this is always devastating to think about, but my uncle worked for an organ donation company. And so his job was to go to the different morgues and talk and go and retrieve organs for donation. And he actually just moved to a different job because he said the most cases he saw were teen suicides. because their organs were still viable. They were healthy, and if caught in time, they were able to use almost everything if that youth was an organ donor. And being a father and an uncle and having all these children and youth in his life, he just couldn't handle it anymore, seeing just how many teenagers he was seeing on a weekly basis committing suicide. And I don't blame him. I don't know how he did it, but it's become, you mix these suicidal thoughts and these psychological impairments, and then you combine them with social media and things that are happening on social media with bullying, and the pressure to fit this image, this perfect image. And it's too much for some youth to take. And so what are the warning signs? How do we step in? If you hear a child talking about how they want to die, or talking about how it's just hopeless, life is hopeless, if they're talking about how they're just a burden to everyone around them and it would be better if they just weren't there, don't take comments like those lightly. So often I hear, oh, well, teenagers are just so dramatic. Maybe, but these are things I'd rather be wrong and step in than ignore them and think of them as being dramatic and then miss a sign. If we see youth increasing their use of drugs and alcohol, being really anxious or overly agitated, just behaving recklessly, like they just don't have a care in the world, they don't care if they get hurt, speeding, for example, in their car, and just not caring, weaving in and out of traffic, withdrawing or isolating from everyone. If they're experiencing very extreme mood swings where they might be really happy one moment and then completely depressed and isolate the next moment, that could not only be a sign of something like bipolar disorder, but if they're having a manic episode where they're in a low, that can also lead to severe depression and suicidal thoughts as well. So I did want to make sure that the image on the slide was the National Suicide Prevention Lifeline. So if you know anyone who's at risk, if you see any of these signs, if you yourself are struggling during this time, please reach out. Please talk to somebody. It's completely it's safe, right? They're not going to tell anyone if you call them. They're not going to tell on you unless you're not safe at that moment. So really take advantage. It's completely free. But I just wanted to make sure that that was the last image that you saw after talking about this really important topic. So that's all I have for you today. I feel like every week we've ended on a really down note, so I apologize for that, but we're getting into some serious stuff with adolescence. I'm going to go ahead and stop the recording. Let's see.